Hello everyone, this is Dr. Praveen Kr Gupta, and today I'm discussing about the FMGE question which was asked in the June 2021. Before I start the session, I have a few honest talk to you. Number one, if you look at this question, they are mostly clinical, and that is how the questions are actually going upon. But I'm very confident, and I'm very proud to say that most of the question to be discussed today has been exactly asked from my notes of the Gurukul 2021. Let's have a small view into all the questions, which is actually in the number of 15 to 20, a huge number, and will show you where do they actually were taught in my notes in the Gurukul. Let's start it. The question number one is a 24-year-old female came with the complaints of neurological deficits. Okay, so when you see neurological deficits and a pallor with the peripheral smear as given here, what you see here is definitely an hyper segmented neutrophils. Why? Because look at the counter number of lobes 1, 2, 3, 4, 5, 6, 7. So this is a huge number of lobes. It surely can be a macrocytic anemia. Now, macrocytic anemia, you all know, is of two types: can be folate or can be B12 deficiency anemia. Now, in the discussion of the Gurukul, I very clearly told you that when we talk about the B12 deficiency, there's definitely something called as neurological deficits. And in that, you also get something called as the hyper-segmented neutrophils. Was very clearly told to you. The question that can also be asked here is they can show you pancytopenia, they can show you the abnormal NC ratio in the bone marrow. So all other things can also be asked from you from this topic. However, if you look at this topic of neurological deficits, surely the answer is very clearly. Answer is B12 deficiency anemia. Next question. A 60-year-old male complains of low backache. On further evaluation, he was found to have anemia and electrophoresis showing monoclonal protein. Okay, so it's definitely something called as monoclonal protein. Very important word. High calcium levels and creatinine levels. That means there is hypercalcemia and there's something that is renal insufficiency is setting in. Multiple punched out lesions. Now this is completely a giveaway question. You don't need to see a lot of things, but if you look at this image, well, this is exact image I also showed you in my Gurukul lectures, and this is what is called as a MOT cell, a finding you expect in the plasma cell or a multiple cell myeloma. So with the history of monoclonal proteins, hypercalcemia, renal insufficiency, and such type of MOT cell, the surely answer is multiple myeloma. This was discussed very clearly in my notes where I showed you there's a plasma cell with an eccentric nucleus, there's a MOT cell or a grape cell, and there is a flame cell also in the multiple myeloma. You could also notice the Dusher body, which is the intranuclear inclusions, and the Russell body, which is intracytoplasmic inclusions. So please have a look at other questions which can also be asked from this portion, in which I have clearly discussed about the multiple myelomas. A 15-year-old male had a progressive intra-abdominal mass was the next question. With the peripheral liprenopathy, he has night sweats, fever, and a huge weight loss of 8 kgs over the past few months, which definitely is a significant history. Gene analysis shows a translocation of 8 with 14. Well, if you remember, I had very clearly told you in my lectures that when you see chromosome 14, think of a lymphoma there. Because most of the lymphoma have a translocation with chromosome number 14. It can be like 1114 for mantle, 814 for burkits, 1418 for the follicular lymphomas. So this is very important. And because this history, which was very clearly discussed also in my notes, in which I discussed about Burkitt lymphoma, I told you these are the 314 translocations which can be seen, like 814, 28, and 822, which makes it very specific for the multiple myeloma, for the Burkitt lymphoma. Reason being, the c-MYC is present on chromosome number 8, as I mentioned here. So clearly, the answer should be Burkitt lymphoma, and the question can also be shown as a starry sky pattern. This question was also there. A starry sky pattern is seen in. The right answer is Burkitt's lymphoma. Right answer is Burkitt lymphoma. A 40-year male worker is working in a cardboard factory for 25 years. He's having breathlessness. So I hope you all know that the cardboard is made up of the bagasse. Bagasse is a sugarcane, the husk that's actually remaining after putting out all the juices. So that bagasse is what will cause as bagasosis. Okay. Now I have discussed very clearly in my notes for hyper cell disorders. I have discussed something that is 3 diseases here among the organic dust, even though it can be from mineral dust also. But here I discussed bagasse, bagasosis. The bacilli which grows here is thermophilic actinomyces, bird dropping called as breeder lungs, and farmer lungs called by again thermophilic actinomyces, which goes on moldy hay. So these three we were discussed very clearly in my Gurukul notes, and the same question, exact same question, also came in this year's of FMG June 2021. Next question. Asbestosis is associated with which malignancy? Now, say in this, always you'll see that two options often given together. One of them is a mesothelioma and one is the adenocarcinoma. Okay, and I understand it's a very confusing question, but when we talked about this Gurukul, in this Gurukul, I tell you very clearly that the asbestosis, they have a three clear-cut cancers. It can be adenocarcinoma, more common than malignant mesothelioma. I told you very clearly, adenocarcinoma, more common than malignant mesothelioma, was a clear-cut mention in my notes. And then I also mentioned that the other cancer that can be caused is of the other areas, like it can also lead to the tumor of the ovary, of the colon, or the other tumor which can happen with asbestosis. Okay. There has been a bee sting to a lady. Bee sting. Okay. The main mediator which is seen with it. So what is the main mediator with the main bee sting injury? You have to know it is actually a type 1 hypersensitivity reaction. This first reaction was very clearly mentioned in the pathophysiology I mentioned here. It is actually the pollen taken up by the APC and stimulating Th2 cells, then activating IL-4, IL-5 and IL-13. IL-4 stimulates the B cells to release the immunoglobulin IgE. And I hope you remember the IgE binds to the cell called as mast cell to release the very, very important mediator called as histamine, which is a clear-cut answer in the above given question. So yes, histamine is the main mediator which causes flushing, edema, and respiratory distress because of the bee sting injuries. So right answer here is surely histamine. Okay. A 35-year-old male presented with thyroid swelling is the next question. In the past 10 months, histological examination shows orphan eye nuclei. What is your diagnosis? So in this question, you can see very clearly that papilla made here. These all are the papilla. You know, papilla is what? Papilla is just a finger-like projections. And very clearly you can see the nuclei have wide area inside it. The nuclei has wide area inside this. Not to forget, it's only because of this orphan Annie who is actually an English comic character, and look at her nucleus and look at her eyes. The eyes do not have any nucleus. I do not have any eyeballs. So this nucleus, look at her eyeballs. They look the same, and hence the name was called as orphan Annie nuclei. The right answer is papillary carcinoma. This question was very clearly discussed in my notes, and you can see papillary carcinoma. I told you a few things which can also be asked in the next time. They can show you some bodies. Most commonly, they present as solitary lesions. This is how we understood it's a normal follicle making this papillary folding here. And then I mentioned very clearly that these are what? These all are the cells which have these white color areas. Compare this to the orphan Annie eye nuclei of this girl. Yes. So what you're saying is a next question. Next question. Small, medium-sized trial vegetations found in both sides of the heart valve. Both sides. And seen in SLE patients virtually complete. The exam is telling you, please identify me. Who am I? Is it MBT? Is it rheumatic heart disease? Is it infective or Limb sac? The right answer is obviously Limb sac. And now look at this 4 clear vegetations I showed you in my notes. So this I showed you was what? A rheumatic, because of small wart variations on the lines of closures. A large bulky infective endocarditis on the valve cusps. A large verrucous, which is actually NBT. Okay, and on both the sides, again being verrucous, is what is called as Lippmann sac endocarditis, was clearly mentioned on both the sides of the cardiac valve, is the undersurface. So I mentioned it about as the Lippmann sac endocarditis, was very clearly mentioned in the notes. So right answer to this question is Lippmann sac endocarditis. Lippmann sac endocarditis. Post-COVID patient having a black discharge from nose and headache. So black discharge, this is a question which is everyone expected, was also discussed in the COVID cure videos that I made. And this is what? It's a fungal hyphae which actually aseptate, the broad aseptate fungal hyphae being shown here in the LCB stain. It can be a case of mucormycosis. Yes, the invasive aspergillosis, invasive type of the fungus, which is actually the mucormycosis, as well as will show you not a black discharge, but may show you a white to yellowish discharge. Okay. A tall stature, next question, presented with gynecomastia. Okay, with gynecomastia. And absent secondary sexual characters. Absent. Genetic analysis shows a bar body. What is it? So, I hope you remember we have discussed in our notes something with the help of mnemonics. For example, the mnemonic for Marfan's was Marfan's, the mnemonic for Turner was Clowns, the mnemonic for Klinefelter is Klinefelter. So simple, I made it for you. Klinefelter may karyotype is 47XXY. You all know the number of bar body is when there's 2x minus 1 is equal to 1. So it should have definitely one bar body, and one bar body in a male, first there's one extra X chromosomes. Long stature was a clear-cut history given to you. And not to forget, there surely is the absent or reduced secondary sexual characters because of the testosterone getting reduced. The secondary sexual characters being absent was clearly mentioned in the notes, was a simple mnemonic Klinefelter. So, if a patient is having a bar body, a tall stature, he can have infertility, unique body proportions, high FSH, high LH, and because of more estrogen, there can be gynecomastia. There can be some learning disability, and the question answer becomes Klinefelter syndrome. I hope you all mentioned, I remember that Marfan syndrome mnemonic was Marfan's, Turner was Clowns. Please go through my notes to understand these things again. And Down syndrome has a clear-cut problematic situation as a simple mnemonic I gave you to understand everything about Down syndrome. So these are very clearly asked questions in the FMG and can also be asked in the NICT and the upcoming exams. So make sure you are well versed with it. These mnemonics are must and must to know. Next question. A 16-year-old male has pain abdomen, especially on the left side. His father also had similar history and developed some GI malignancies. Colposcopy finding is shown below. What is your diagnosis? Well, if you look at the number of polyps and start counting them, it will be more than 100. It can be thousands also. So what you must notice here is the history. The history telling you there's pain abdomen and a similar history and in the father, which is suggesting it's an autosomal dominant inherited pattern. Well, it was discussed under the FAP, familial adenomatous polyposis in my notes. Mutations being of the APC gene, it is actually autosomal dominant, and not to forget the number of polyps is more than 100. There can be two associated syndromes here, Gardner and Turcott, which can also be asked in this typical case. The right answer to this question was definitely a case of FAP. Why is it not carcinoma colon? Because there's not a one single growth or there's not a ulceration in this area. Why not ulcerative colitis? Because of this typical history of the father having the same type of history. Celiac will show you a malabsorption rather than just a pain abdomen on the left side, and the colposcopy will not show you such type of polyps in either celiac or the carcinoma colon. Okay. Next question. Supravital staining is used for. So remember one thing, when we talk about supravital staining, this was discussed in my notes under the heading of reticulocytes. Was clearly mentioned these are immature RBCs and they stain with supravital staining. The three examples, new methylene blue, brilliant blue, and crystal violet. These are the reticulocytes, and you compare them to the normal RBCs which are small in size and surely have central pallor. This was the image I showed you in my notes, and this is what is called as reticulocytes. Amongst these are all the RBCs here. It's a reticulocytes, which is actually what? It's a supravital stain used for nothing but a reticulocyte with the immature RBCs, and when they're increased, this is what? This is actually what is called as a hemolytic anemia. A reduced reticulocyte count is seen in what is called as a hypoproliferative anemias. Okay. Next question. A 30-year-old male has a painless testicular mass. He has normal AFP levels. So why is the exam giving you a normal AFP level in a paleness testis mass? Because he wants you to rule out where from paleness it can be teratoma or choriocarcinoma. Both of them have different features. How? A choriocarcinoma actually is an invasive. It's a highly malignant tumor. Will show you not a painless mass. It should be painful. Poliocarcinoma will surely have high level of beta HCG. A teratoma will have a three germ layer pattern. It can show you some tooth-like pattern, can show you some hair follicles, can show you some sebaceous cysts, bone, muscles, and thyroid tissues can also grow in a teratoma, because ultimately it is what? It's actually a germ cell tumor which belongs to all the three germ layers. So, where did I discuss this? Again, this was also discussed. Yolk sac tumor, I mentioned in my notes, has a AFP level to be increased along with alpha 1 antitrypsin. When you move to seminoma, I told you seminoma is a germ cell tumor. Seminoma has a two markers. It can be PLAP or can be LDH. Okay, but when you talk about the painless mass, look at this question. When you talk about the painless mass and a normal AFP, answer surely is nothing but a seminoma. Okay. Next question. A elderly male working in a dye industry for 40 years shows hematuria and increased frequency and urgency. Well, hematuria है, increased frequency है, and urgency है. What is this talking about? There's a dye industry. When I told you in my notes, if you talk about a dye called as benzidine, so benzidine dye is often linked with a transitional cell carcinoma. Not to forget, I told you aniline dyes are seen for kidney cancer, benzidine for transitional cell cancer. I also mentioned in my notes that there is something which is actually causing hematuria, okay, in a bladder carcinoma will be transitional cell bladder carcinomas. Okay. Next question. A 35 male has swelling around the knee joint. X-ray shows a soap bubble appearance. Well, if you have read orthopedics, you need to look at this. It's clearly a straight answer. But when you notice here, it is what? These all are giant cells. I told you in my notes that giant cells are the tumor cells. The tumor cells are the molecular cells you see here. The giant cells are just an incidental finding, but the name is definitely a giant cell tumor. I mentioned this clearly in my notes under giant cell tumor, also called as the osteoclastoma. Well, it is a bit uncommon, benign, but locally aggressive neoplasm. Well, this tumor you see here, these all are the giant cells here, which actually are what? These actually are the normal. That means they're incidental findings. The tumor cells here are the molecular cells, which is you see here, which can also be a question which can be asked next time. Have been clearly mentioned here. So please go to this area where I mentioned you clearly about what is called as a giant cell tumor. Okay, the location again is very important. It comes in epiphysis but may extend to metaphysis. These things are very, very important, guys. Okay, most likely diagnosis in a lady with low TSH, high T3, T4. Well, I explained to you this in a physiology of this entire thyroid gland. Look, there is a release of TRH from the hypothalamus, which will then stimulate the pituitary to release TSH. This will give a feedback by releasing T3 and T4 to decrease the amount of TSH. This was discussed very clearly, and then I mentioned about what happens as a feedback regulation here. So when you see a high amount of T3, T4, a low amount of TSH, you're dealing with a case of hyperthyroidism. Okay, and among them, hyperthyroidism is actually what? It is a Graves' disease. Okay, it's a Graves' disease. Now, why is this patient not having subclinical hyperthyroidism? Because most likely the case was also giving you a history of some hyperthyroidism features, like it was a tachycardia, it was a high blood pressure, or the other option, other also history given here, which was not very clearly mentioned in the student's recall, and they were not mentioned here in the question that you're seeing here. Okay, but this question was widely discussed here in the topic of thyroid disorders physiology, is when I discussed the entire thing. Next question. A mid-aged female has a weight gain, constipation, and on lab test has antitpo antibodies positive. This lymphocytic infiltration in the glands. Well, remember, Riddles has fibrosis, Graves has hyperthyroidism. Here the finding is giving is hypo. How? Weight gain, constipation. Hashimoto is the right answer here. I'll tell you why. And dequervance will show you what? It shows you granulomatous lesions in the thyroid and not a lymphocytic infiltrates. Remember about Hashimoto we talked about. It's an autoimmune dysfunction in which you find a problem in the PTPN and the CTLA4 genes. Because of it, there's a breakdown of self-tolerance and because of which the T cells, they start infiltrating the glands, forming destruction of the glands. These glands are destroyed in a way like this. And this can again be a question in the next time, which can show you a oxyphil or Hurthal cell change. There can be a germinal follicle formation, and not to forget the dense lymphocytic proliferation, which can also occur here. So when a patient has anti-TPO antibodies, the answer should be a Hashimoto thyroiditis. Remember, if a patient has a receptor antibody, thyroid receptor antibody, it will be Graves' disease. It will be Graves' disease. Okay, the basic thing that you should all know to understand this. It can also be called as TSI, thyroid stimulating immunoglobulin, which again is found in the Graves' disease. TSI is the name of those antibodies. Okay, a lady with breast cancer, her biopsy report shows indent file pattern. Well, this is a typical giveaway question. They are asking you to please identify me. How? Look at the notes. Again, discuss clearly in the notes. Yes, it is actually showing you a medullary cancer. A medullary cancer has monomorphic cells with plenty of lymphocytes around it. It is called as miliary pattern tumor. In this pattern, called as indent file pattern, the tumor cells are non-cohesive and they are all separate like this, because of which it looks like as if many soldiers are standing in a straight line, and hence the name is indent file pattern seen in an invasive lobular carcinoma. Please remember, below this area, I've discussed with other tumors like a choroid carcinoma. I also discussed with you the micropapillary pattern, including the invasive rectal carcinoma of NOS type. So please go to this area because this can be surely a future question that can be asked to you. Right answer this question because of the breast cancer, and the indent file pattern would be yes, it should be a case of invasive lobular carcinoma. Okay, next question. So many questions came from pathology. Which of the following etiology of HCC? Well, the question was asked in a different way. The question was a laborer who was taking a lot number of peanuts, and he was also taking a lot number of food grains because of low socioeconomic status. Remember, for those who have a HCC, the risk factors are, remember, alcoholic cirrhosis, Hep B, Hep C, NASH, aflatoxin was the clear-cut answer here. It can be autoimmune hepatitis, it can be PBC, the primary biliary cirrhosis, and can be these precursor lesions, which also is very important. However, this was the question asked aflatoxins. Remember, aflatoxin is a toxin which actually is found in food grains and also in the grains which can, and the peanuts, which can have some amount of moisture growing in it. Aflatoxin is due to release of the fungus called as asbestos flavus, and that can lead to release of toxins, can lead to the hepatocellular carcinomas. Please go to the other etiologies also, which can be seen in HCC. Right answer is aflatoxins. Next question. A 2-year-old presented with recurrent episodes of diarrhea and abdominal distension. He has failure to thrive. He shows a upper GI endoscopic biopsy showing villus atrophy. Yes. This was discussed in my notes again, and this is where we discussed it. We don't discuss this here, that there's a pathophysiology of celiac disease, and remember this one. I showed you two images to compare them side by side. This is a normal villi, with these are the crypts, and look at this complete loss of villi and the elongated crypts here. This is called as celiac disease. Yes, loss of villi and elongated crypts are the two findings you can expect in what is called a celiac disease. And therefore the answer is celiac. It can't be IBD because IBD doesn't show you villus atrophy. Intestinal TB and typhoid fever will show you ulcers. Remember one thing, typhoid, I also mentioned this in the notes. Is like a longitudinal ulcers like this. Okay, and intestinal TB shows all the horizontal ulcers like this. Okay, so these all were the questions which are discussed by me also in the eGurukul app. So make sure that you should remember all of them. You should discuss and remember all of them, because these questions will surely be a future question that can occur and can come in the INICET or next time in the combined session of the FMGE exams in the next pattern, or can also be a question in the NEET 2021, which is going to happen a few months later on. But please understand, the notes are very important for you to remember and revise it again. Please remember, notes are not a thing to revise it once. Please watch the videos and then revise the notes again to make ensure that whatever I have taught you, you know everything in and out of it. Wishing you all the best and stay ahead in life, stay blessed, and be very safe throughout this season. Goodbye. Wishing you all the best is Dr. Praveen Kr Gupta. Thank you.